partners in healthcare, government, and media for joining us today, but also for everything that you're doing to keep our community safe and to keep our community informed. So we will start. Nancy, would you like to start us off with updates from the Virginia Department of Health?
Yes, and I'll be brief. We really did decide that we don't need to do this every week, guys, because we've kind of reached a plateau. So we are certainly willing whenever the media or the chamber wants us to come back, and I'm sure Tori and her team feels the same, to update you on what is going on. I think we are going to have some exciting stuff to announce sometime around the 1st of May. So we are gone but not forgotten, and here if you need us. The first thing I wanted to talk about was we sent out a news release this morning noting that we're officially moving to 1C. We have done some 1C folks in our clinics as opposed to throwing the doses away, but basically we're looking at people who are instrumental in running our society just like 1B, energy workers, wastewater, waste removal, housing and construction, food service, transportation, institutions of higher learning, but just the staff at this point. Finance, information technology, and media friends, you are 1C. So you may go on the website and register at this point. Legal services, public safety, and other public health workers like me who aren't usually on the front lines. So Dr. Gately says the move comes because our hospital partners at Carilion and SOVA have worked very hard to administer as many vaccines as we can supply. And because of their willingness to hold large vaccine events, most 1A and 1B populations seeking vaccines have received them. To date, and this is, last checked yesterday, the West Piedmont Health District has administered 47,503 doses of the vaccine. When you think about, we have 5 public health nurses, the hospital staff is rather, none of us have surplus people. So we're repurposing our people, the hospital, and I think that's breathtaking, and we should take a moment to just say, wow, good job, excellent job. So, let's see what else I wanted to point out. We know that there are still some people out there under 1B who haven't gotten their vaccines, but we don't know who they are. So we would like to call on the public. If you know an elderly shut-in or someone who should be getting the vaccine but hasn't, someone with serious chronic health conditions, they qualify, please take it upon yourself to help them register at vaccinatevirginia.gov or to call the Vaccine Virginia 800 number. You can register for them, and you can do it on the telephone, or you can call and then hand them the telephone, or you can simply share the information and let them know that they're due a shot if they want one. To date, we have not been having to beg people to take shots. People in the West Piedmont District have been very willing to step forward and protect themselves. But there are still some that are on the fence. So if you feel strongly about it and you've had yours or you believe in the vaccine, encourage people, your neighbors, your coworkers, people at church. The final thing, I just wanted to give more details about tomorrow. We will have First Lady Pam Northam and Secretary of Health Carey visiting the health department in Rocky Mount. They did not have time to come down to Martinsville, but I've enticed them with the Speedway, so they may come down, Tori, to the Speedway sometime and check that one out. It's right off the interstate there, so I think the next time they're down in Danville or somewhere, we'll organize that. But I did want our members of the media to know that I can have a few media people here. This is not a press conference type of thing where you'll be asking questions and they'll be answering. It'll be sort of a public relations visit where they're going to tour the building, they're going to thank the health workers, and it's possible that Secretary Carey will actually vaccinate someone in our afternoon clinic. It's a 20-minute in and out visit. And if you would like to come, please let me know, because I'm going to allow 3 to come. So let me know about that. And I think that's it. If you have any questions, I guess we'll take those at the end of the presentations. Thank you.
Thank you, Nancy. Tori, who will be leading off for the hospital?
Thank you, Sharon. I actually would like to start with Dr. Gunn-Nolan. She's actually in clinical this week, so she is doing bedside care. So I need her to have a little bit of time, and she's got to get back to taking care of patients. So Dr. Gunn, if you would like to, I know Bill Wyatt had a question that was submitted earlier this week, and Bill, I don't know if you want to recap that for us so that Dr. Gunn-Nolan could address that.
Hello? Can you hear me?
Yes.
Okay, I'm having a unmute issue here. Yeah, I don't have the question in front of me, but did you read it, Doctor? The question that I submitted?
I did. So if I summarize, correct me if I'm wrong, one of the questions was as in regards to masking for those that are vaccinated and then around those that may not be fully vaccinated. And then the proper wearing of a mask, and I actually have one of the question was if it's below the nose, is that helpful at all? Or is that even appropriate? So if that is the correct question, is it?
It is, yes.
Okay, so we'll start with the wearing of the mask and proper wearing of the mask. There's been many cartoon drawings about the equivalent to wearing a mask beneath your nose, but no, it's not helpful. So this is a circuit, so air through the nose and mouth, and all the same virus, bacteria, everything is going to come out your nose and your mouth. So by not covering both, then it's the equivalent to really not masking at all. There's been a lot of confusion even as far as double masking or do I need to wear 2 masks? Really that comes from layers of cloth. So medical grade or these disposable masks have a moisture barrier. Having that moisture barrier keeps from particles passing through faster. When we have just a tied bandana or one layer of cloth there, then your breath actually makes that cloth a little bit moist, and that makes particles transmit a little bit faster. So you're actually spreading or the equivalent to not wearing a mask. So that's where that 2 mask rule kind of came from, or that recommendation. It's not that you have to really wear 2 masks. If you're wearing something that has that moisture barrier, like these disposable masks, or a lot of the homemade masks actually have multiple layers of cloth, then that helps to protect further. Other confusion comes from, do I need to wear a mask if I'm fully vaccinated? The first part of that is to be fully vaccinated, you're 2 weeks out from your 2nd dose. If you've received a Johnson & Johnson, then that's also considered a 2-week out from that 1 dose regimen. That is fully vaccinated. That's what it takes for your body to have built the immune response. Before that time, you are not protected. You can still, if you get exposed, you can still get sick. Being around others that are fully vaccinated, the CDC made recommendations that you could be around those individuals without a mask and safely, but the concern was, in particular, I believe there was a meeting or a gathering where others surrounding may not be fully vaccinated. That's the concern. That's why we want everyone to continue to wear a mask. When I go out in public, I am fully vaccinated, and I have been for a couple of months now, but I continue to wear a mask whether I'm in public or in meetings here in the hospital, or even, you know, in a small group with my residents that I teach. The reason being, everyone has a different timing of when they got that vaccine. I know not everyone around me has been vaccinated. It is my duty, it is my job to make sure that I am not continuing to spread COVID. Just because I've been vaccinated, I can still spread it. I won't get sick, so I won't know that I'm spreading it. So in these meetings, in these town halls, in these public gatherings and things like that, it's important that whether you're vaccinated or not, you continue to mask. It's going to be that way until we reach that 70 to 90% of the population, and we know that. And luckily, because of the rate vaccines are coming out, we hope that that's going to be sooner than later. But at this point, we're just not there. So I ask that everyone continue to wear that mask. It is so important. What we don't want with the success that we've had, what we don't want is to start to see a rise in cases just because people have felt really comfortable going out in public and gathering and doing these things that we so desperately want to do now, especially after a year of this, but it's not quite time yet. Any other questions I can answer from anyone, or if there's further questions from that, I'm happy to before I head back up to the floors.
Okay, no one has any other questions for Dr. Gunn-Nolan?
Oh,
Okay.
Charles does. Charles, I believe you're on mute.
Okay, can you hear me now? Okay. With closing the meetings down and so forth, do you think by July that we will be at least 90% back to normal?
I think by July, we're going to be closer to normal than we've ever been. I really think we're going to start to see a closer to normal summer than what we would have expected even a few months ago. It's been amazing, the efforts to get vaccines out. So I think we're going to start to see some return to normalcy, but the important part to get there, people have to get vaccinated. Without that, no, we're going to reach a stop and get into gridlock if people don't go get vaccinated.
All right, one last question, because there is that fear of getting vaccinated, which is amazing to me, but that fear still lingers. Have there been any local problems?
No.
Yeah.
No. So, and even globally, to be honest, as far as issues with these vaccines, when I say these are the most researched vaccines, they really are than any other vaccine that has ever been created. The safety profile of these vaccines are safer than any other vaccine that's been created. It's pretty amazing stuff, the efforts that went into getting this vaccine created. I think there's a lot of factors that went into play to promote that fear, especially in a time of social media and a time where politics has kind of prevailed during a global pandemic. We really want to encourage everyone to get that vaccine. It is safe. When we talk about the number of lives that have been lost from COVID, and we don't have deaths from a vaccine, we have deaths from COVID. So I think we want to make sure we identify what we're still really fighting.
Well, let me tell you what, I want to tell you that I really like your spunk and enthusiasm.
Thank you so much. Thank you.
Yeah.
I have a question as well. Adding on to what Charles talked about, people being afraid of the vaccine. Another question that arises with that is, why should I get the vaccine if I could still get sick or get the virus as well? That's one of the biggest questions that we hear in the community of why they say they don't want to get it.
Yeah, so we talk about what that vaccine really does, and we talk about, really with any vaccine, when we push flu vaccines and we push other things, our efforts to, when I say push, we're trying to save a life. That's what it comes down to. That is our effort to save a life. With these COVID vaccines, even if you are exposed, but you're still in that window where your immune system is making a response, building a response, we talk about the severity of that illness. It is, you're talking about a runny nose versus life support or death. And that's the gravity of the situation. So without that vaccine, and your body doesn't build that response, doesn't build that army to fight this fight appropriately, you're walking in with no protection. And it's important that people know, even if you've had COVID, that is not a prolonged protection. You are partially protected for 90 days. That's partial protection for 90 days. And you can go through that rodeo again. And just because you survived the first time does not mean you survive the second or the third time. It is imperative that people get vaccinated. I think we're going to start to see a push. We talk about getting back to normal. I think we're going to start to see a push for a requirement to prove that you were vaccinated before you're able to participate in things. And that's a safety standard. That's to save a life. And so it's not, we talk about politics that get involved. We talk about the science and the conspiracy theories. Realize that this vaccine, what it comes down to, you get that shot, you're protecting yourself, but you're also protecting those around you and those you love. We want people to celebrate a more normal summer this summer, and hopefully an even more normal summer next summer. We're ready to be together, and we're ready to have what feels like a normal life. And I would love to meet all of you in person instead of through a video or from the eyes up, but people have to get vaccinated.
Thank you, Dr. Gunn-Nolan. I know you need to get back to the floor, so we do appreciate your time that you were able to give us today. And Tori, do you have more to add from SOVA?
Yes, I'll just give a quick update since we've been talking about vaccines and the administration thereof. I did want to update that as of today, SOVA Health in total for the Danville Martinsville campus has administered or redistributed over 26,021 doses of the vaccine. Martinsville, as of today, has administered nearly 11,000, and after today, we will eclipse that. But we have a total, as of yesterday, of 10,098 vaccines that have been administered here on the Martinsville campus. 6,640 of those are first doses. 3,459 of those are second doses. I do anticipate that over the course of the next couple of weeks, we'll close that gap rather quickly. We have some large second dose clinics coming up. So we'll see those numbers start to collapse upon itself, and then we will have numbers that will be reflective of those that are completely vaccinated. To Dr. Gunn's point earlier, seeing through their second shot regimens is vitally important, that you do see through those second shots so that you can be completely protected. The Danville campus, respectively, has administered 15,923 doses. As I stated, we will continue to see through our second dose clinics. We also have a weekly site at the National Guard Armory on Thursdays, which is today. So we have one that we're doing today that we will see through until there is no longer a need here in the community. We also are partnering with the Speedway as well as local EMS with Matt Tatum, Henry County Public Safety, and some other first responders there. In operations, when there is a need, we will do another large scale clinic that has not been scheduled, but we will schedule that in the days to come. And I know, Matt, you have some updates as well in regards to some things that you're doing, so I'll hold the remainder of that for you. In terms of the Armory site, we are partnering with the city officials, as well as our city emergency management services and first responders at that site to conduct that on a weekly basis. I can give an update that across SOVA Health, we are currently treating 13 patients who are positive for COVID-19. 3 of those are on the Martinsville campus and 10 of those are on the Danville campus. So we continue to see those numbers decline, as we talked about through the year. Through this year, we've started to see those numbers decline, which is evidence of the vaccination efforts and also the community's responsibility, being very responsible in maintaining social distance and masking and the like. And I think that is about it. The last thing I would like to say is that we did have life outside of COVID. You know, before COVID, there was life, and there were also medical conditions that needed to be treated. And I want to make sure that people feel very confident and safe that we are still here as a hospital to treat you for any medical condition that you have that arises. And I realize that there's a lot of emphasis around COVID, but I also want you to be very in tune with your own body and make sure that you are aware of signs and symptoms of other things, such as heart attacks and strokes, because those are very time sensitive. And the earlier that you recognize that, and the earlier that you seek medical treatment, contacting EMS, to start that treatment there in the home, and then also on your arrival here at the hospital, the better that your outcome will be. And so I just want to encourage that, because those things unfortunately did not go away. In fact, probably have even deepened a bit with COVID. So please don't delay care. We're here and we are ready and always here for you anytime that you need any type of care. Thank you, Sharon.
Thank you, Tori. And also thank you for reiterating that, yes, it is safe to come to the hospital, because that is such an important message that we want everyone to know. I know I've had the opportunity to be in the hospital, not be in the hospital, but to be there. And I know you guys are taking every precaution that you can to keep everyone safe. So yes, that's a great reminder. So thank you. Okay, John, if you'd like, we can move on and you can give us an update from the city of Martinsville.
Hey, so like Tori said, we're still working the site at the Armory on a weekly basis. Today is a first dose site. I think next week would be a second dose site. And we're looking at probably at least another maybe 4 to 6 weeks of this. I'm not 100% sure yet how far out we're going to run it, but as long as there is a need, we will staff the site.
Thank you so much, John. And Matt, if you would like to give us an update from Henry County.
Good morning, everyone, and thank you, Sharon, for hosting this call again. And just to echo some of what Ms. Shepherd said, we are continuing to work with the Sova Health with a great relationship there with the large-scale events, 500 or above type doses at the Martinsville Speedway. We do have the race coming to town the next couple of weeks, so hopefully after the race is completed and successful, we can start looking at having those more on a regular basis. Also working with another community partner to try to get out, do some more smaller type events, like around 100 dose type thing, and make it more like a mobile type concept where different days of the week will be in different parts of the county. So haven't got the details of that totally worked out, but now that we're opened up to 1C, that drastically increases the number of people that the vaccine is available for. So as long as we've got vaccines available, I want to get them out into the community. We all know that we cannot begin to see what our new normal is going to look like and have the best possible new normal until we get this this herd immunity and the vaccine out there. So if you have any questions whatsoever about your vaccine or considering or on the fence about the vaccine, I encourage you to contact your primary care physician. All medical decisions need to be made between you and your primary care physician, in my opinion. So contact your primary care physician and have that discussion. And then, of course, do what they tell you to do. But there will be more opportunities coming up. I encourage everyone to stay abreast of what's going on. Go to the state's website, get registered to be put on the waiting list so that you will be contacted when we have these sites available. So thank you, and I'll stick around if there's any questions.
Thank you, Matt. Lisa, on behalf of the chamber, do you have anything you would like to add before we go to questions from the media partners?
Just a quick thank you to all of the partners for being so collaborative and just being so dedicated, and we just can't thank you enough. So we want you to keep on being safe, and we truly appreciate everything that you're doing on behalf of our community.
Thank you, Lisa. We'll start with questions from our media partners. Bill, do you have further questions for any of our healthcare government partners?
I'm good, thank you.
Okay, thank you. Okay, Luis, do you have further questions for our government or healthcare partners?
Yes, I do. The first question is going to be, I don't know who can provide some information on the clinic